Paisley and the storm. Well, it's kind of appropriate, I guess, going into today's today's show. We're not going to talk about storms. We're going to talk about radon, and it's a very serious topic. And Sara told me yesterday when I visited with her that she's going to have some free radon test kits that they're going to be giving away with the Department of Health. We'll find out how you can get one of those here on today's AM Minnesota program. So stay tuned, folks, as Dan Tranter, who is Mr. Radon in Minnesota, right? You're Mr. Radon.
Well, thanks. You flatter me. I'm the indoor air supervisor at the Minnesota Department of Health.
You're a radon information officer. I saw that
I am.
On the EPA website.
I am the designated person.
And I know you wouldn't say this, Dan, but from everything I've read, you're one of the foremost authorities on this in the country, not just Minnesota.
Thank you. I'm blushing. I appreciate the compliments. We have a lot of knowledgeable people at the health department on radon and around the country too, and at the EPA and other agencies, and also at the universities, and a lot of good people in the private sector as well. So it's a big community of knowledgeable people.
I've been talking to you for a number of years about this, and you're such a young guy. Did you start doing this when you were 13 or what?
Yeah, pretty much. No, I've been with the health department for 16 years almost, so it's been a while.
Oh, it's only been that long.
Yeah.
Was there a point man before you? I know I did shows on this in the early 90s.
Yeah. There was a supervisor named Laura Oatman in the 90s,
yeah, I remember
followed
Laura.
by Dale Dorschner was a supervisor for a while, and he did a lot of the interviews in the early 2000s. Then Jim Kelly, and then I've been the supervisor for about 5 years.
It doesn't seem like we've been talking about this for a long time, but I saw on your website that radon was discovered in 1899.
Well, yeah, we've known about radon for quite some time. There's a flurry of research around that time as we discovered new elements, including radioactive elements like radon. And that's what radon is. It's a type of radiation. It's found in the soil, and then across the 20th century, we continued to research radon where it's found. We started to study its effects on miners, of course, being underground. Miners were exposed to a lot of radon, and we started to understand the health effects there. And then the research turned to what people are exposed to in their homes, because our homes are in contact with the soil. And air comes in from the soil through the foundation into our homes and other buildings. And past couple of decades, we started to see that people can get affected from radon, and that there was a higher risk of lung cancer in people living in homes with high radon concentrations. So here we are today trying to raise awareness, let people know about this risk and how it's easy to test and easy to fix our homes.
And Sara, Rice County is a hotbed of radon activity.
Yeah, yep. The state just put out a press release stating that across the state, about 40% of our homes in Minnesota have dangerous levels of radon. And here in Rice County, it's actually closer to 60%.
Isn't that something? 60%. And you're talking about dangerous levels. You talk the next category, you can add another 20-some% on top of that. So almost 80% of homes, right?
Well, I would clarify, the highest rates in Minnesota, there are some counties that are around 70%, but right here in Rice County, you have some of the highest levels, not only in the state, but in the country. In northern Minnesota, the levels are a little lower, but you're still looking at about 20 to 30% of homes being high in northeast, north central Minnesota. So it's high across the state, and that's the homes that are over the action level of 4. Now, if we drop it and say, what is the rate of homes that are above 2, and I think that's what you're referring to, Gordy. If we look at the homes that are above 2,
79%,
then it's closer to 80%. And what we say at the health department is if you're over 4, you should definitely take action to reduce radon. If you're over 2, meaning say you're between 2 and 4, you might still consider taking action, because it's not like it's safe at 3.9 or 3.2 or whatever. It's similar, as we were talking with Sara earlier, it's kind of like smoking, It's not like 1 or 2 cigarettes are safe. There's some risk associated with lower levels of exposure to cigarette smoke. And at 4 picocuries per liter, the risk is equivalent for lung cancer to 5 cigarettes. So if you're exposed to 4 picocuries per liter of radon over many years, the risk is similar to smoking 5 cigarettes a day.
Have a great defensive package with us. To find out how to get Spray Brand's 2024s and 1956s on your farm, go to our website at spraybrandsseed.com or give me a call at 507-383-3927.
Again, on AM Minnesota, we have a couple of folks in studio that are going to tell us, educate us about radon. Radon. This is Radon Action Month, right, Dan?
Certainly is. January's National Radon Action Month. Our governor's proclaimed Radon Action Month in Minnesota as well. And we're just trying to raise awareness. We want people to test their homes this month. This is a good time to test in the sense that it'll probably be at its highest point in your home in January. But it's also important to remember that radon can be high in homes any time of the year. So we can test our homes any time of the year, just as long as you keep your home closed up, meaning keep the windows closed and the exterior doors closed. Normal entry and exit's okay, but we can test in the spring or fall too. Just keep those windows and doors closed.
You have one of those test kits, one of those?
I do. So this is a short-term radon test kit. This is the kind of kit that most people use.
Yep,
this
that's
is
what I had when Sarah was nice enough to let me have one a couple years back.
Yeah, and this is what we buy with our grant dollars and give them out to the counties, and the counties give them out for free, or sometimes they sell them for a couple of bucks. Sometimes the counties buy their own supply of kits. Very easy kit to use. It comes in an outer plastic sleeve. You take that out. There's some information on the back people need to fill out, like the start date, start time, and such.
Yep.
And then you leave it in the lowest part of your home that you spend time in. So if you spend like 10 hours a week in your basement, put this kit down in the basement.
10 hours a week?
Yeah, or 1 or 2 hours a day.
Okay.
If you don't spend much time in your basement, you only use it for, say, storage and laundry, and you're hardly down there, I wouldn't test the basement. I'd test the next level up.
Okay, that was my first mistake.
Well, you can always test again.
Wait till you hear my second mistake.
I was just going to say, yeah, you leave this kit out for a few days, like 3 to 7 days. Then when you're done, there's this cardboard insert. You want to take that out and toss it. There's an adhesive strip on the inside of the kit. You seal up the kit, and you pop it in the mail. The kit is also a self-addressed envelope.
Right.
It goes off to North Carolina in this case, and you'll get your report back in a week or two.
Okay. The problem is, see, now I did all this, I filled it out. I didn't mail it in.
Oh, okay.
I mean, I waited too long, and I
Yeah.
thought, well, there's no way it's not going to be effective now.
You got to mail it right away.
Right, that's what I thought.
Yeah.
It was like a week, and I said, gee, silly me, I should have sent that in.
A week might still be okay. I mean, at the end of the day, I would just send it in. The lab will make the determination
Sure.
as to whether it's usable or not. The other thing I always recommend is on the top left corner of the kit, there's a kit number. And I'd recommend you write that down, because if for some reason you don't get the report,
Right.
or it gets lost in the mail or whatever, you can go online within 60 days. You can punch in this number and it'll give you the results of that test kit.
Right online.
Online, yeah. Or if you don't have the kit number, you can call the laboratory, and depending how long it's been, they may give you the result over the phone.
But you have to have that test kit number. They don't go by names. They go
Well,
by
if you have the
numbers.
test kit number, you can go online and punch it in. If you don't have the test kit number, you can call them up, give them your name and address, and they may be able to look it up and give you the result.
Oh, okay. But they mail out the results.
Yeah, I mean, most people don't have any problems. They get the result by mail or email or both. Sometimes people will call us and say, oh, I never got my result. Well, if you call the lab, they can give it to you. Or you can go online, punch in the number, and find it.
Okay, that's good to know. But very simple. I mean, if I can do it, other than the stupidity of not sending it in, anybody should be able to do it.
Yeah, it is very easy to use. It's easy to test homes. You can test it yourself. If you're buying a home, you might want to hire a home inspector that's a qualified radon measurement professional.
Sarah was very smart, you know.
Yeah.
Weren't you, Sarah?
Well, you bought a house that had a system already, right?
Yep, when we bought
Yeah.
our home here in Faribault,
Oh,
our
I thought
home
you
already
asked about whether or not it had been tested.
Well, it had been tested, and it had a mitigation system already installed when we bought our home.
Okay. That was the deal.
So now we just check it to make sure the mitigation fan is running.
Yeah, the mitigation fan. And
Yeah.
you said you came across the bill, you think, and it cost about $1,500 to do this mitigation.
Yep. The previous homeowners had left us, of course, like our appliance records and warranties and things like that. And
Right.
among those records, we had found that a bill for around $1,500 for the mitigation costs.
Now, when you think about the value of your home and the value of the lives that live in your home, $1,500 is not a lot of money, Dan.
Yeah, of course, Cordy. We think it's a very important investment in your health and the health of your family and loved ones. I think it improves the value of your property, so when you sell it, somebody comes along, a buyer looks at the house, gives them peace of mind that that's not going to be an issue. We are seeing a lot of testing being done by home inspectors during real estate transactions because the buyer asks that a test be done by the home inspection.
I would do that if I was buying it.
Yeah, so then they find the problem, and then they can negotiate. The buyer and the seller can negotiate. The buyer can say, I want a system installed. And the seller, in many cases, will end up putting in a system. So I always tell people, why wait till when you're selling the home, when everything's rushed and stressed out? Why not fix it now? And then you can enjoy the benefits, the health benefits, and it'll make the real estate transaction go more smoothly. So don't put it off and wait. I would say test now, and if you need to, hopefully you don't need to, but if you need to, you can fix it.
What I want to know is why it's not required.
That's a good question. Why is there no requirement to test for radon? That's a question you'd really need to pose our legislature. I don't write the laws, our legislators do. But there is no law currently requiring radon testing or mitigation, whether it's in homes or apartment buildings or schools or anywhere. We do have some disclosure, notification requirements in home sales. We have some radon-resistant features required in new construction for new homes. So there are a couple of laws concerning radon, but nothing that requires testing or requires mitigation.
Okay, Liz, I heard you right here, but if I know I have high levels of radon, I have to tell the person I'm selling my home to. If I know.
Yeah, so that's an interesting question. That's how the law used to be. But in 2014 it changed. So now we have what's called a disclosure and notification law. So it's a little different. So now when you sell your house, you have to disclose the fact you haven't tested, right? And then the buyer sees that, and then there's information, a two-page fact sheet, and a warning statement underneath that. So if you haven't tested, you're going to say, I haven't tested. And the buyer is going to see all this information about radon and how it should be tested, it causes lung cancer, and you can test during the home sale. So it used to be the way you describe it, where you don't have to say anything unless you've tested. Well, that discouraged people from testing. Mm-hmm. So the legislature fixed that by passing the Radon Awareness Act that requires disclosure and notification, and that's really increased the testing that's been occurring. Yeah, a lot more testing and mitigation has occurred in the last couple of years.
Although, well, I probably shouldn't share my opinion, but I will. I think it should be required to have all homes tested when you're going to sell a house.
Yeah, that's interesting. There was actually a bill introduced in 2013 that would have required that, but it didn't make it out of committee.
Because we know it kills people.
Yeah, certainly there's a case to be made that testing should be required. There's a county in Maryland. The only place in the country that I know of that requires it in home sales is a county in Maryland called Montgomery County. There is a state, Maine I believe, requires rental properties to be tested by landlords. So there's a couple of areas in the country where there's testing requirements. Some requirements in daycares in a couple of places.
And in Minnesota, we have more laws than practically anywhere. We don't have one dealing with this. It just blows my mind. Sorry, Dan. That was my comment. You don't need to.
Yeah, I don't make the laws. I just try to implement them and educate people about them.
So, Sarah, how can people get one of these free radon test kits that Dan just held up to the camera there?
People can come on over to our Faribault office, so that's located at 323rd Street Northwest, or if you're closer to the Northfield area, 801 Washington Street.
Just stop in.
Just come on in. We'll ask you to fill out a short informational sheet about time that your home was built, when you intend to use the kit, but that's all. That just helps us look up test kits if people need help looking up their numbers.
Do you get the results as well as the homeowner?
De-identified. I only get results by the test kit number, and I can't look it up by people's name and number, so I also need that test kit number.
Okay. But I think it's good that you guys have the information, is
Yeah.
what I'm saying.
Yeah.
Now, you said earlier something that really concerns me. I'm more of a stickler of this one. I think schools definitely ought to be tested.
Well, we certainly recommend it. It's obviously a good idea. I will say this about schools. Schools tend to have lower levels of radon than homes because of the mechanical systems that are used in schools are different. You know, in homes we have a furnace, maybe an air exchanger. Schools have large air handling systems. So usually radon levels are low in schools. That's what our research shows. But in some cases, schools can have a few classrooms that are elevated. So we certainly think schools should test as well. We have some training and recommendations for schools as well as homes. And I wanted to add something earlier, what Sarah was saying with
Sure.
the test kits. You can also get test kits online directly from the laboratories. This kit currently costs $9.95. So you can get it for free from the county, but if you want to go online, if they're out for some reason, because from time to time we don't have kits, you can go online and buy it for $9.95. You can also go to hardware stores and buy kits. They will cost more at the hardware store, but there's a lot of different ways you can get kits.
Is this kind of like a detector? Like a carbon monoxide detector?
It's not a digital piece of equipment.
Right.
There's you could kind of hear that sand-like sound. That's granulated activated charcoal, and the radon sticks to that. So it's a different technology than a carbon monoxide alarm.
But I mean, are there any kind of detectors that one could buy that detects radon?
Continuously, our professionals.
Invent that, Dan, and you no longer have to be the radon man.
I can start a business. There are these plug-in devices that homeowners can buy, but we don't recommend them. They cost a lot more. They're going to cost a couple $100, number one, and they're not approved devices, so we do not recommend them. If you want continuous monitoring done of your home, you should hire a radon professional with a high-tech, sophisticated continuous radon monitor. Those devices cost a couple $1,000s, and they need to be calibrated annually. So we're not going to recommend the average homeowner go out and spend that kind of money.
Right.
But you can hire a professional who can bring that equipment to your home and monitor your home if you wanted to really know at a very accurate level what the numbers are, how they vary by hour. If you wanted to really dig deep into it, you could. But doing a do-it-yourself test is very accurate and good too. So that's what we typically recommend.
You could read my mind. That was going to be my next question, Sarah. How accurate is this?
They are accurate.
There must be
yeah.
a margin of error, right?
Well, there's an error, and you'll get that in your report. There'll be a plus or minus
Right.
error on it. The main thing that can go wrong with the test kit is more the user error. Like if you leave the windows open during the test period,
You don't mail it in.
you forget to mail it in, or it goes in late, or
Well, you can't rub that in.
if you don't want to put it like in your crawl space because you're not breathing that air. Who cares what the radon levels are in a crawl space?
Well, my
or
cat
some
might be
pole?
down there sometimes.
Well, that's true. If you want to think about your cat, I suppose you could
If I
test
had
in
one.
there, but
But pets, does it affect pets?
I actually was on the CanSAR website the other day, and it did talk about pets being affected.
Okay.
I think it does. It hasn't been researched very much, but I think we could probably say it does because they develop cancers too, including lung cancer, and they're breathing in the air, and it's going to damage the lungs. So it probably does too.
It
Certainly.
seems to me we've been talking about the same stuff for many, many years here. Anything new that's
What's
come up recently
new?
concerning radon?
Yeah, what's new is the data analysis we did last summer. If you're into maps and data and numbers, which I am, I like to geek out on the radon data. You can go to our radon data portal, and I think, Sarah, is that on the KDHL website? Or?
Yeah, I believe Gordy has put it up on the radio's website, and so people could access it there. It's called the Minnesota Public Health Data Access Portal.
Yeah, and there's all sorts of recent data you can look at if you're interested in that. Other than that, there's ongoing research, of course, worldwide on the health effects, and we're adding to our knowledge of the health effects and strengthening the association between radon and lung cancer. There are some other studies that are suggesting perhaps it could be linked to other types of cancer, but that research is really early right now, so we can't say with confidence that it causes other kinds of cancer. But we have a large amount of research now that shows that it causes lung cancer.
Okay, so forgive my ignorance on this. If it's colorless and it's odorless and it's tasteless and it's invisible, how do they know this?
Well, we can measure radon with devices such as the one you can test in your home.
Do they do this when they do an autopsy?
No, the way we've understood the health effects of radon is similar to the research that was done on smoking and exposure to UV and how that causes skin cancer. So they do what's called epidemiology. This is the backbone of public health, the research method we use. And they study groups of people. So they look at people, for example, in Iowa. They did a lot of research. And they looked at people who live in high radon homes. And they went and measured their homes. And they looked at people with low radon homes and measured their homes. And then they made sure there weren't other things that could be affecting their health, that there weren't differences. And what they found in places like Iowa and around the world, that people who live in high radon homes end up getting lung cancer much more frequently than the people living in low radon homes. Similar to with smoking. Decades ago, they did this research and found that people who smoked are much more likely to get lung cancer than people who didn't smoke. So that's what we use in public health. So when you read these stories about the effects of too much alcohol consumption or obesity or the lack of exercise, most of that research is based on this epidemiological method that we use in public health.
So they didn't physically detect radon in the lungs of...
It's very difficult to do that accurately, so we don't try to measure it in that respect. It's through these population studies, these epidemiological studies.
Sure.
We do it.
So again, Sarah, people just drop by your office or City Hall in Northfield.
Yep, either location should be able to connect somebody with a radon test kit. If we are out, like Dan had said, we would direct somebody to an online source or another provider. I believe Ace Hardware has been carrying test kits here in town. So
okay. So I could go over down to Ace Hardware and buy a radon test kit.
Yeah, it'll cost you more. It may not include the analysis fee. I think you typically have to send a check with the kit.
These, you don't have an analysis fee?
No, this you send it in, they'll analyze it for you. You don't have to send a check with the kit. No.
Wow, somebody pays for that, right?
Well, we do. The health department gets a grant from the U.S. Environmental Protection Agency.
We do.
So yeah, you do. Taxpayers do ultimately.
Yes.
It's your tax dollars at work in effect, because we get a grant from the federal government. We buy test kits in bulk at a discounted rate, and then we give them out for free to the counties, and then the counties use them to raise awareness and to help with testing.
These test kits haven't even changed over the years.
They haven't. It's a simple, very simple technology, but it works. And we want it to be cost effective, obviously, and we want people to test.
When you think of how technology has changed over the years, these have been about the same. But if it works, what?
Sort of like a mousetrap, right? Technology hasn't changed much either.
I never thought of that. Do you have earliest test results of radon in homes in Minnesota? I mean, how far back do we go when we start? And the reason I'm asking this is, are we seeing more now than we did before? And why would that
good
be?
Question. We don't think we're seeing more now. The first efforts to really understand radon across the country and in Minnesota specifically happened in the 1980s. The 1980s did some testing in all 50 states. They did some geological surveys. They came out with a national radon map. And if you Google EPA radon map, you'll see this national map. And then since then, we as the Minnesota Department of Health have analyzed data that's been collected across the state. And this most recent data analysis we were talking about earlier is on our website. That's found similar levels to the analysis done in the 1980s.
Dodge County, 65% 4 picocuries per liter and above. 66% in the Seward County, 64% in Steele County, 67% in Waseca County, 58% in Goodhue County. So all the counties around us a little higher even than Rice County at 57%, and Dakota County is at 37%. Quite a drop off there.
Yeah, as you move into central Minnesota, the levels are a little bit lower. So in the North Metro and into North Central and Northeast Minnesota, the levels tend to be about 20 to 35% elevated, which is still very significant if you think about it. If you have a 1 in 5 chance of a problem, that's still really high.
Right.
So
yeah.
we don't focus too much on geography, but there are problems across the state. It's just a little less likely to be a problem in central and northeast Minnesota.
Well, I'm going to guess, Mr. Radon Man, that you are recommending, in all seriousness, that every home, every apartment,
Yes.
every school be tested.
That's the basic message from the health department. Learn about radon, and then test your home, test your building, test your school. If there's a problem, you can fix it. The engineering is not difficult. We can fix virtually every building, every home. And the cost, I think, is reasonable considering the health benefit and the improvement it brings to your house.
So when I'm building my new home, which will probably never happen, but if I was to build a new home, I would think I could implement some of these things while building the home.
That's a very interesting point. So since 2009, our homes need to be built with radon-resistant features. So homes have to have a radon pipe that vents out radon passively. There's no requirement for a fan in new construction, just the pipe and some other features. That works to some degree.
And the fan, though, I'm hearing.
The fan really makes it a lot more effective. So you can ask from your builder, okay, I know, Mr. Builder, I know you're going to build to the code, but I also want the fan added on as an optional feature.
Okay, well, maybe you need to make that part of the code, for gosh sakes.
It isn't in the code currently. It's optional to add the fan. The passive system does work to some degree, but still in some of these homes there's high radon, so you should test.
This show's too short today. Sarah, I ran out of time. Dan, I ran out of time, but I sure appreciate it. Thanks for coming down.
Thanks for having me.
Thank you so much,
That's
Gordy.
greatly appreciated. Get out and get your home tested, folks, and don't do like I did and forget to mail it in. You're in tune to KDH Lamb, Faribault Minutes.